Hi, I'm Dr. Miner, and we are here today with Stephen. And Stephen has a root canal that has a little infection going on in there. And what we are going to do is clean that out and redo the root canal. So with this infection, have you noticed anything with that tooth?
I just noticed discoloration in the tooth.
Okay, it doesn't feel any different.
Nope, doesn't feel different.
Okay, that can be very typical, right? Especially not feeling it. But that doesn't mean it's okay, because that means at some point it's going to flare up and hurt. So as we redo this root canal, we're going to use all our technology for this. We got our scope over here, we have our laser over here, and we're going to be planning how we're going to do this to get the best effect and best result. And one of the things we're going to plan for is, just in case, what if it doesn't heal? We have a backup plan. Now with root canals, one of the best ways to disinfect the root canal is using the laser. Because the laser can penetrate really far into the tooth, right? Because we usually use some kind of cleaning chemical, and that gets a little bit on the sides. But the laser, we want to kill as many bacteria as we can, because that's the problem, is the bacteria. And so studies have shown laser has the highest disinfection of anything out there. So after we get done, we got to give the body some time to basically let Mother Nature take over and clean up the infection, help kill the bacteria and seal up the tooth. So what we need to do is wait about 3 months, maybe 6 months, and we'll take another x-ray. And if we still don't see healing, which that can happen, and we'll talk about that in another video. But what our plan is, we need to go in surgically from the side, right? We'll go in right here, and we remove the end of the root, because that's where the bacteria can still reside because of tooth anatomy. Now the reason we want to address this infection now, because patients think, well, it doesn't bother me, and there's even dentists that think, well, it doesn't bother you, so let's not worry about it. But then what happens is it flares up and it really hurts. And then the person just wants it out, which that's not good. And even if they think about replacing it with an implant, implants are not like natural teeth. They're going to have issues and problems, and we want to avoid that. So there's ways to address this. So we're going to take care of this infection, see how it heals, and if we don't see hopefully it just heals up fine. But if we don't see healing, we have a backup plan. We got done and got the tooth treated again, got the old filling material out from the root canal, cleaned it out, used the laser to disinfect, and we didn't even numb him. So tell us, what did you think about it? How was it?
There was a little bit of pain, a little zapping, but all in all, not too bad.
Okay. Do you wish you would have gotten numb?
No.
No? Okay. That's the important part.
Yeah.
So now we are in a holding pattern, and we need to let his body do his thing. We want Mother Nature to clean up the bacteria there and cover up the tooth. And so we will have him back in about 6 months, and we'll check it with an x-ray. If it's healed, great. And if we don't see any healing, we're going to do the surgical approach that we had talked about earlier, which is where we go in from the side, and we're going to remove the end of the root, and we put some filling material in the back end there, and then that should heal up.